Welcome to DermWire News, powered by DermWire.com. DermWire News for Smart Speaker is made possible with advertising support from Ortho Dermatologics. I'm Stephanie Talea, Senior Managing Editor with Practical Dermatology magazine. Platelet-rich plasma reduces the signs of aging on the face, according to the first randomized study of PRP. In the trial, 19 participants received PRP injections to one side of their face and a sham treatment with a saline solution to the other side. 6 months after a single treatment, patients reported significantly improved skin texture and wrinkles on the side treated with PRP. By contrast, expert dermatologist raters did not see significant difference, possibly due to photos not capturing textural change. The findings appear in JAMA Dermatology. There was change that patients who know their faces well could see clearly even 6 months after the procedure, says lead investigator Dr. Murad Alam, Vice Chair and Professor of Dermatology at Northwestern University Feinberg School of Medicine, and a Northwestern Medicine physician in Chicago, in a news release. But it was harder to detect for the raters who had to make determinations from photographic evidence. The fine textural change was hard to capture in the photos. The best method of assessing texture is to actually feel it. The study is exciting because it shows that just one treatment of PRP does appear to improve sun-damaged skin for as long as 6 months, particularly by reducing unevenness and roughness in the skin, Dr. Alam says. Side effects of the PRP treatment were short-term and mild, including redness, swelling, and bruising. The study did have its share of limitations. Investigators did not see much improvement in brown and red skin discoloration. They also don't know if repeated treatments would magnify the anti-aging effects of the injections. A novel 1060 nanometer diode laser system is safe and effective for hair removal and long-term hair reduction in all skin types, including darkly pigmented individuals, according to research in Lasers in Surgery and Medicine. 16 patients who were treated with the chilled sapphire tip, the Lightshear Infinity 1060 nanometer chill tip ET, showed a mean 68%, 82%, and 76% skin type-independent hair reduction in axillary, shin, and arm, respectively, at 6-month follow-up visit as compared to baseline. Treatment with the large spot size vacuum-assisted handpiece, the Lightshear Infinity 1060 nanometer high speed, was most effective in the axillae and calves with a 77.9% and 78.5% hair count reduction, respectively, at the 6-month follow-up visit. Pain was minimal, and common post-procedural responses included mild to moderate erythema and/or edema. Large spot lasers with suction can provide comfortable hair removal in dark-skinned patients, concludes study author Dr. E. Victor Ross, director of the Laser and Cosmetic Dermatology Center at Scripps Clinic in San Diego. Younger individuals and females are more likely to use tanning beds, and as a result, they tend to develop melanoma earlier, according to new research published in the December issue of the Journal of the American Academy of Dermatology. In a survey of 434 melanoma patients conducted at the Washington University School of Medicine in St. Louis, patients who developed more than one melanoma were more likely to report indoor tanning bed use, and patients with multiple melanomas who used indoor tanning beds developed their second melanoma more quickly than others. Specifically, the median time to diagnosis of second primary melanoma in patients who used tanning beds was 225 days compared to 3.5 years among participants who didn't use tanning beds, the study showed. Our findings provide evidence for heightened surveillance in melanoma patients exposed to artificial ultraviolet radiation, the study authors conclude. Thank you for listening to DermWire News, powered by DermWire.com. This editorially independent program is supported with advertising from Ortho Dermatologics.